In medical coverage now at 5 tonight, 3 major lapses caused widespread COVID-19 outbreaks in Missouri veterans' homes. A new report was released this week after independent investigation into the Missouri Veterans Commission's response to COVID-19. KOLR 10's Bailey Stroll read over the 50-page report that just came out today. She's here with what it revealed to let us know more.
Thanks, David. The report took data from 7 veterans' homes in Missouri and found 3 main factors that led to COVID-19 outbreaks: the absence of recognition, proper planning, and effective response. And as of mid-November, nearly 350 veterans in these homes had tested positive for COVID-19. 103 had died.
This was a structural and systemic issue. Failure to interpret the data, a lapse in reporting and communication, the absence of a contingency plan, and the following of PPE policies. No one of those things is the driver.
Missouri Veterans Commission Chairman Tim Noonan says the commission is mostly made up of volunteers, people who typically know the role they play but had no clear outline of how to handle a pandemic.
When we were completely overrun, we ran out of quarantine space. That was the insight, that we did not have that continuity plan in place.
Although the MVC had a COVID-19 contingency plan, Noonan says it wasn't helpful by the time COVID-19 outbreaks became uncontrollable. The report says there was no clear training for staff, which led to no precautions being taken while test results were pending. Both positive and negative COVID-19 patients continued to share living facilities and bathrooms, facilities not being disinfected properly, and a shortage of staff led to workers serving patients across multiple units. So when COVID-19 cases started growing exponentially at the 7 veterans' homes in the state, Noonan says MVC failed to communicate those concerns to Missouri's COVID-19 response team.
Could we have done better? Absolutely. And again, a very, very complex healthcare environment overwhelmed a very, very well-intended workforce.
Now, the law firm that analyzed the data, Armstrong and Teasdale, also gave a list of recommendations to the MVC, some of that which have already been implemented, others that the commission is still working on. They include developing a specific threshold for COVID-19 response, securing rapid testing through April of next year, working with the state to ensure veterans and staff receive vaccine priority, and lastly, setting up a hotline for families to call with questions and concerns.
All right, Bailey Stroll tonight. Thanks.